Now we have come to the fourth and the last presenter, Dr. Muhammad Sif AZHAR MERICAN Abdullah. He's a director from KAJANG General Hospital, Ministry of Health, Malaysia. Upon of his postgraduate training from London South Bank University in 2015, Dr. AZHAR currently serves as a hospital administrator with the Ministry of Health Malaysia, over 15 years of leading 6 different public hospitals. He has commissioned 2 new IT hospitals and is currently on his third for a women and children clinical block, making every staff and patient excited about it. He is a data-driven and evidence-based in all decision-making, hence bridging the gap between clinicians and administrators. Dr. AZHAR also emphasized quality and patient safety in his day-to-day work, admitting him as an accreditation survivor for the Malaysian Society for Quality Health, MSSQH. He also actively conducts research in health management and has published in them in academic journal as well as presentation in the international conferences. He was awarded fellowship in epidemiology and biostatistics by UNSW Australia in 2023, and his action research and contribution in putting policy in place to control and manage the hospital through the pandemic. Dr. AZHAR receives numerous local and international awards from LEED Green Hospital, Ibadah Friendly Hospital, UK Alumni, and AEMAS Energy Management. He was bestowed by many awards from local royalty and His Majesty King Charles III. Dr. AZHAR is a traditional archer and spends time with horses to calm the heart and mind. So, for the final presentation, please give a warm welcome to Dr. Muhammad Sif AZHAR MERICAN Abdullah of KAJANG General Hospital, who will be talking on the challenges for digital health literacy for high-risk group in Malaysian public hospital. Over to you.
Thank you, Edison, for the welcoming. And I would like to thank the organizers for inviting me, and to all attending the webinar. Thank you for staying to the end, as I'm the last speaker for the day. And if I would be allowed to share my screen, I have a short presentation. I hope to reach Prof. Sarah's level one day to deliver a talk. No, without any presentation slides. Prof. Sarah, if I may. Right, okay, let me just get that up. Okay. Right, okay. I'll be touching on the challenges of digital health literacy for high-risk group patients in the Malaysian public health hospitals. And I'll be covering the following for this evening's presentation, starting with some definition and introduction, and followed by an example of a digital health that was carried out in one Malaysian public hospital, and then probably some discussion points before I end my talk. And there are several key definitions that I would like to share, and this kind of wraps up what Dr. Stephen has presented earlier. The definition on digital literacy, right? Digital literacy is the ability to handle any device, for that matter, computer device, to access information in a digital format, assess its credibility and relevance, and then being able to apply it to a specific context. Whereas health literacy is the social and cognitive competencies that determine a person's level of motivation and ability to assess, understand, and use information in ways that promote and maintain good health. And finally, specifically for this talk, digital health literacy means the ability of individuals to search for, to understand, and to evaluate health information obtained from electronic sources and to apply the knowledge acquired to address or solve health problems.
Dr. Azhar, could you make it, because your slide is not moving, could you make it a slide presentation mode?
Okay. Presentation. Okay, is it moving?
Oh, it's not up here. Yeah, maybe our site share the screen for you. Is it possible?
Okay.
Possible? Yeah. Okay. I think our team will do the sharing.
Thank you, thank you. Sorry for the trouble. Okay, I think we move on to the third slide, please. Okay, right. So this was the definitions that I mentioned earlier. We can move on to the next slide. Okay, digital health technology, as Prof. Sarah mentioned earlier, I mean, according to the US FDA, the FDA defines digital technology as the broad scope of categories that involve electronic health records. You have virtual visits, you have wearable technology, digital therapeutics, AI, telemedicine, and machine learning. Now, in health literacy, we have seen that patients have moved from searching and receiving health information from their healthcare providers, mainstream media and hard copy education materials, to electronic via the internet using various devices. This online health information seeking behavior is also observed in low to middle income countries, including Malaysia. Digital health literacy has also promoted the provision of health services and also improving self-care and health outcomes. However, during implementation, local challenges were observed in the Malaysian public hospitals. Next slide, please. This slide is to share a telehealth project that was undertaken last year in one of our new cardiac centers in the Klang Valley. This was a basic application that was created by the cardiology department to cater for cardiac patients. And the objective was to allow some form of teleconsultation and to also have some remote patient monitoring. Because this cardiac center is one of the national referral centers and they receive referrals from throughout the country. Then the other main objective was to actually reduce patient congestion in the clinic by enabling staff patient consultation online, ability to remotely monitor the patient's vital signs and symptoms, such as blood pressure and heart rate, as well as to send medications over to the patient's homes if the vital signs and symptoms are normal. Next slide, please. However, after 3 months of implementation, we only managed to reduce the patient congestion by only a mere 20%. Now, this was because majority of the heart patients had difficulty to engage in teleconsultations, and patients ending up coming to the clinic anyway for follow-up and medications. And when we did some background studies, this group of patients, they fall under the category of either the elderly or the less educated, as well as the lower income group. Next slide, please. Now, these findings were similar to what we have in the literature. This article was published in 2023, just this year, by Tiwari et al., using a review method to look at utilization of telehealth in low to middle income countries. And out of the 467 articles, 44 articles were analyzed. They reported several challenges that were similar to our Malaysian setting. Number one, inaccessibility to telehealth services. access to communication devices such as smartphones, computers, and other electronic communication devices was a challenge, including access to internet services, data, web-based applications. Number two, lack of technology literacy and support. The patients were not holding phones at proper angles to improve the quality of videos and photos for clinical examination. In addition, some of the patients had lack of understanding in terms of the application, buttons to press, and so on. So this made navigation a challenge for some of these patients, hence ended up to be frustrated and demotivated to use the application further. Number three, loss of interest in telehealth service utilization among patients. Due to poor connectivity in some rural areas, there was poor connectivity to both the hospital and the patient's home. There were also inappropriate timing of phone calls made by staff, as some of our patients were either at the supermarket or they were driving to work and so on. These articles also report loss of interest and income on the physician's side, as well as there were poor security standards on telehealth programs, including security breach, which are also some of the concerns of our patients. Next slide, please. There was another study by AZHAR and all in just last year, looking at the elderly. Now, this article reported several barriers to video consultations. Now, as we all know, geriatrics are patients or anyone for that matter who are aged 65 and above. Now, geriatric patients and their caregivers, as well as healthcare personnel, experience difficulty navigating technology, lack of technical support, and privacy concerns. Now, since with that, hence health systems should consider older adult needs and preference when implementing telemedicine in outpatient setting. This is exactly what Prof. Sarah mentioned earlier to cater to the specific needs of the population involved. Next slide, please. Now, based on the patient factors that I've just shared, it will be also interesting to look at some of the societal challenges as a whole. Now, digital technologies need to deliver affordable, easy to use healthcare solutions, especially to the elderly, which we've just seen in the slide previously. It is also interesting to note that the characteristics of patients who have limited ICT access or skills are similar to the social demographic factors associated with health disparities, as what we see in some low to middle income countries. This would include the elderly, the less educated, lower income group, minor ethnic group, and those living in remote areas, all of which have lesser access to the internet for health information and communication. As such, these socially disadvantaged groups are usually overlooked in e-health design and are at risk of becoming digitally marginalized, leading to further widening of the health disparities. Next slide, please. Next slide, please. Thank you. Now, this is a systematic review conducted about 3 years ago that explores e-health literacy in users who are under the socially disadvantaged group, namely the elderly. Next slide, please. Yeah, namely the elderly, the minority ethnic group, low income group, low education, and rural communities. Now, this review analyzed a total of 48 interventions, e-health interventions to be specific, and found that health literacy was not considered in any of the studies during development of these e-health interventions. Now, end user involvement in designing any of these interventions was also limited. Hence, the study concluded that health literacy was generally overlooked when developing interventions for socially disadvantaged groups. Next slide, please. Now let's move on to, from the patient's perspective, to look at the other spectrum of end users, which are the medical practitioners or doctors. This local article was published in 2021, is to show that digital literacy is also a challenge within medical practitioners in Malaysia. Now, this was despite during the pressures of COVID-19. Now, the report here shows that 62.5% of medical practitioners admitted to have technical difficulties in handling telemedicine during the recent pandemic. Next slide, please. Now, there are some ethical challenges to it, which Prof. Sarah also rightfully mentioned earlier. The increasing digitization of healthcare and the growth of mobile devices as a data collection tool raises many ethical issues. One commonly recurring theme that relates to exact nature of consumer tech companies such as Amazon, Apple, Google, Facebook, or Samsung, they have all entered the digital health domain. They offer solutions for collecting, storing, and analyzing health data, which raises issues of privacy, data protection, and informed consent of patients. The nature of health data is also changing. We are now collecting more private user-generated data, particularly data harvested from social media through wearable technologies than ever before. As well as issues mentioned above of privacy, protection, and consent related to data ownership that are previously discussed, the growth of app and technologies developed from consumer raises ethical issues relating to how we should regulate such technologies. Now, these issues is made worse at the speed of advancement and increasing globalization of healthcare solutions. Next slide, please. This is the conclusion for my talk this evening. I think we will all agree that health literacy is a critical determinant of health, as what Prof. Roy rightfully mentioned in his opening remarks. And digital health literacy remains as a challenge in Malaysia, especially in the high-risk group patients, and including the vulnerable population, and as well as medical practitioners in our setting. And as we have seen in some of the published papers, any design of health application should consider its target population to gain its optimum benefit in return. Because one model for cardiac patients may not fit in cancer patients, for example. And lastly, it is suggested that we could use some tools, for example, e-health literacy questionnaire that is available to identify and engage target users to ascertain the usage of applications to be developed. The next slide, please. These are my references for this talk. And again, I would like to thank the organizers for having me this evening. Thank you.